Saturday. What is this? Uh-oh. What's good, everybody? Um, that's not really what I want. Let's move you there. So I'm just gonna check my stream to make sure it's not like an echo before I start talking. So come in the room, just say hello. Let's check it. Just say hello. Ooh, no echo. Let's check it. Just say hello. Ooh, no echo. Let's check it. Just say hello. All right. Let's check it. Just say hello. Whoa. Happy Saturday, guys. How y'all feeling today? Come in the room and let's chat. Chat with the dentist. Today's topic is, how to stay positive even when you don't feel like it. How to get up and just continue to live your best life even when you don't feel like it. Because life be lifing. So I just wanted to pop on here and chit chat with you guys. So come in, drop your questions, and let's talk. So if you're watching this on the replay, you can also come in and just let me know how your day is going. I'm gonna put this chat box up here, maybe that'll work. Yeah. So I'm just gonna give it a little time for chat box. Boom. Let's put y'all right there. So yeah, so this year has been kind of crazy. And the time has went so fast. I cannot believe it's already December the 21st. Okay. But yeah, the time has went so fast, and I'm looking forward to 2025. So I could say this year, one thing that I learned is how to stay positive even when you don't feel like being positive. How many of us know that that is so hard to do? So many people go from 0 to 100 real quick. They do it real quick. But I've learned this year that you really have to pick your battles because every battle isn't really worth, like, your energy. Let me go in here and share something really quick. So y'all pop in and, let me know how y'all feeling today. Chat with the dentist. I'm just here if you guys have any questions. And yeah, give me just a second. I'm going to share this broadcast. Where is it? So I'm dealing with a little cold here. Still, it's going away. It's getting better. And also a stupid shoulder injury. So that's how I'm ending my year. But as we go into 2025, what are you guys what are you mostly looking forward to? You know, I know what I'm looking forward to. I'm looking forward to just continuing to grow. Because sometimes we can get so hard on ourselves and feel like you're not growing. You feel like you take 10 steps back every time you take a step forward. This is life. And sometimes life will have you so confused and in a space where it's hard to be positive. Some people can be positive all the time, but it kind of gets hard to be positive every single day when life be lifing. I mean, just yesterday I was strolling on YouTube and I saw the government shut down. I'm like, what? It's just so much going on um, with everything. The government to me has been a total joke this year. Like, they're a total joke. I don't know how y'all feel about that, but the government has been a total fucking joke. If I could be honest, it has been a joke. So I saw that, and that kind of made me like, what is going on with the government? Why they can't get it together? Like, but they got it together, I guess, and they raised the debt ceiling or something like that. And to me, I'm just like I started to research the money in this country and how much that this government is in debt and how they just keep printing money on the fly. So that's creating a lot of inflation, a lot of different issues across the board. So it's impacting everybody in every industry on every level. You know, groceries are higher, everything's higher, and it's kind of crazy. So you really got to have more than one stream of income to truly survive during these days, because next year I don't really know what's gonna happen, and I'm not for like pumping fear into people. I'm for pumping positivity into people. Like, if you are alive and you're breathing and um, you can wake up and continue to chase your dreams and do the things you love, you don't have no reason to fear. You got to go into 2025 feeling fearless. Like, you got to go into 2005 feeling like you that one, feeling chosen, feeling unapologetic about your life, feeling like no matter what, I'm going to continue to put my best foot forward and be the best person that I can be. I mean, what else? What other choice do you make? Giving up is not an option. Throwing in the towel is not an option. Turning around and going, no, we're not doing that. Living in the past, not a fucking option. Okay? It's just not an option. I gotta blow my nose. So, give me just a second, guys. Give me just a second. Sorry about that. Yeah, I had to blow my nose, but I'm getting over a cold. I'm at the tail end of it, so that's what's going on. But back to our chat. So pop in the chat. Let me know how you're feeling. How do you feel about how this year has went for you? Were you able to learn a couple things? Were you able to grow this year? That's the most important thing. Is, are you able to grow as you go through life and as things change and as this government does what it does and as you learn new things? Like, for me, this has been the year of, really, like, the year of truth. Cat Williams said it best. He set the tone for 2024, and nobody had any idea of what he meant when he said, this is the year of the truth. I feel like it has been a year of the truth for a lot of different things. When it comes to my own personal history, when it comes to just learning about the history of this country, when it comes to learning about business and being in the dental field and having a dental practice, when it comes to just dealing with like all the insurance stuff that's going on. And for me, I know a lot of people got involved with realizing what was going on with the healthcare industry. Unfortunately, due to someone actually getting murdered in regards to that. But, and my condolences to the family. But the healthcare industry is headed to a weird spot, guys. I know, me as a provider, being in network with dental insurances, it literally destroyed my business, if I could say. So I had to really hurry up and go out of network, just because I just see, like I said earlier, with the inflation, with the government, with all the overpricing, overhead in this industry is expensive. So as a provider, you want to help people, but you also have to stay in business. And I was reading something yesterday. It was like a lot of doctors are choosing to quit their job because it's too much overhead. Some doctors are choosing to end their life because of it. So many people are choosing not to go into the industry because it's not the same as it was 20, 30 years ago. And I feel like there's a lot of reason for people making these decisions. I know when I was interested in dental school, I was going to Florida State University. I was just this bright young lady just trying to get out of the hood, trying to defeat poverty, trying to overcome all the obstacles, I was eager to go to dental school. Even though I knew it would be hard, I had the energy like, oh my God, if I get in, this will be a miracle. But nowadays I feel like a lot of people don't have that energy. And that's really because it's a lot of hard work, and to get to the reward of it, you have to really work hard and really, really want it. And to be a dentist nowadays, nowadays, can you do it for money? You have to do it because you love it. But also, you have to know that it's going to be a little tough. So I'm not really shocked that people don't want to go into this career as much as they did before. Um, because it's a different landscape nowadays. You know what I mean? So that's what's going on, and I feel like as a provider, to be honest, dealing with insurance made me like have a strong dislike of my profession. So that's why I had to really, really get out of network. Because the past year, insurance companies basically just robbed the provider. They robbed the provider. I feel like they robbed the patient. They cheat the patient. They don't make it to where the patient can get the things they need done without a hassle. They make it where you have to ask for permission. Oh, and then if it's this amount, they ruin things. So my thing, guys, is with the health industry. Next year it's gonna be a little tricky. It's going to be tricky with dentistry, with medical. In every industry is going to be tricky, and I know that they are predicting like recessions and all of this stuff. But my thing is, we have to stay positive during these times, regardless. You have to stay positive and stay motivated and continue to run your business, continue to grind and hustle. And you can't really let the outside noise get you to the state where you are down on yourself. You feel like you are not worth living your best life. And like I said at the beginning of this stream, it gets really hard to stay positive during difficult situations. And I am so grateful that I have learned to stay positive. Hey, cuz, during difficult situations, because that wasn't always me. Like, normally, coming from a childhood where, you don't have that connection to your parents, losing a mom, um, not really having access to my dad, that can cause you to harbor a lot of childhood trauma. And for me, I know that I was using that trauma to just, I guess, internalize every negative situation that came into my life. You know what I mean? What's up, my cousin in Georgia? What's up, Sean? How you doing? But yeah, I use a lot of that childhood trauma before to just get into a depressive mode. It took me back to the day I lost my mom. Every time something is taken away from me, like whether it's love or friendship or just dealing with the loss of people, or dealing with just poverty in general growing up, all of those things made me feel like it made me internalize negativity. And it took me so long to break away from that, guys. It took me nearly 3 decades to realize, dang, you're harming yourself by internalizing negative energy that you don't have to do. But it's a skill when you're able to take negative situations and turn it into something positive. It's like turning nothing into something, turning bullshit into something. Say, hi, all is well. I am so happy that you are doing well, and I hope all you guys out here are doing well. I'm going to be on here for a while chatting, so feel free to interrupt me. Feel free to drop your questions. I love it when you interact, so I'm just blabbling because I'm on the screen, and you got to talk when you're on the camera when you're live. So I'll probably talk about a whole bunch of different topics during this live. And my primary channel is Twitch, but right now I'm streaming to multi channels. So, I'm going to be on here for a while. On here for a while. So yeah, for me, like I said, the biggest thing that I've learned this year is that well, the biggest thing I've learned about myself is that I need to learn who I am. Because you could go so long, like for me, I was going through life, always in school, always like just chasing the dream, chasing all of this stuff, and not really knowing who I am, and using my education and my dreams to cover up the childhood trauma, to cover up a lot of the negative things about myself, a lot of the emotional imbalances I had. It kept coming up. It kept coming up. And until you fix problems that are wrong, you cannot grow. Like, how can you grow? Glad to see you and follow you. Blessings. Yes, I'm so glad to chat with you as well. Blessings to you during this time. And hopefully, we get to see each other soon because, I mean, the tribe is important. Getting together with your tribe is important. But I'm all the way up here in New York, and it gets a little hard to, you know, connect with my tribe. And I don't like that for myself. I don't like being all the way up here. I don't like being away from my family. I don't like it. Like, I know people probably think that I like it. I don't really like that part. That's one of the things about pursuing your dreams and following your dreams and trying to chase wealth and trying to chase, a way out of the hood and out of poverty. Sometimes you got to leave, and sometimes you have to make this difficult decisions and make moves and make boss moves that most people won't do. Most people would not move to New York and stay here because it is not easy. But it's worth it. But I don't know if it's worth it when you talk about like family. You know what I mean? So if I could just like uproot this dental stuff and move it closer to home, I would 100% do that. 100%. You know? Yeah, cuz I'm so happy to hear from you. Tell everybody I said hello. But yeah, you know. So, y'all chit chat and let me know what's the dealio. Y'all know I'll pull up me some solitaire and I will sit on this screen and play solitaire and chat. The other day I broke a Twitch record on my page on Twitch. I did 4 hours of live streaming, and I'm just growing, and that's what I'm about. I'm about growing. But back to what I was talking about. So, I realized that I was using the childhood trauma to embed negativity into, like, when something isn't going right, it just feels like your world is crumbling down and you just get sad. I can't do that no more, guys. It's something about when you really realize the importance of your time and your life and how precious you are. It's something about knowing who you are and being unapologetic about who you are, that you will say, you know what, do I want to deal with the negativity or deal with the negativity, or am I going to continue to try to push and fight for everything that I deserve? And that's the realization that I came to this year. A lot of things that used to, I guess, weigh me down or make me feel, I don't know. I don't feel that no more. I'm learning to, just pick battles and pick, you know, things wisely, you know? So, yeah. I posted something earlier on my page. It said, never allow the weight of the world to kill your spirit. Never allow the weight of the world to kill your spirit, And I truly believe in that. Like, as I've went through this life, things happen every day. Something's gonna happen that doesn't align with your plan. And if you have a plan, that's good. Your plan is not always gonna go according to how you set it up, and that's okay. This is an opportunity for us to learn. This is an opportunity for us to grow. It's not an opportunity for you to be down on yourself or to throw in the towel. This year, despite how difficult it has been to be an entrepreneur and run a dental practice, let me repeat that. Despite how difficult it is to be an entrepreneur and run a dental practice, Oh, I still stay positive. Some days it's like, what the fuck? But I still stay positive, you know? And I appreciate the growth regardless. And that's the biggest thing for me. I might not have grown as much as I wanted to this year, but I did learn a lot about myself. I learned that things can get really dark and you will still be okay. Like, you gonna be okay. You gonna be okay. Excuse me. The most important thing is like knowledge and history. Before, I really wasn't a fan of history, but just the more knowledge that I get about history, the more important I see it is, you know? And I don't really want to get onto like super history, but I was let me see. I don't know if I should go over my notes that I wrote on this live because it's kind of serious stuff. I want to keep this kind of lighthearted. Yeah, we're not gonna go over these notes here. I'm gonna say that for another time. But since it's so quiet in here right now, I'm going to pull up my y'all know me. I'm gonna pull up my solitaire. But y'all come in the chat and say hello. I think when I share my videos from Facebook, it doesn't really track well because it's an outside source. It's from Twitch to Facebook. So it's not really going to my people. So if you see this, just like it and say something. And while y'all do that, I am going to... Where is my... Hey, AJD! How you feeling today? How you feeling? Happy Saturday. I'm just on here chit-chatting. If you got a question for me or, you know, drop it in the chat. So I'm at the tail end of a cold. This weather here in New York, it's a trip. But a good thing that I love about it now, even though I think it's because of global warming, which isn't good, the weather has not been as cold and snowy as it was when I first moved to New York. When we first moved here, the snow would go crazy. Happy weekend! Happy weekend to you too. One thing I do is I love the weekend. I love the weekend. And this week has been so aggravating dealing with like a shoulder injury. That's kind of crazy for me. I hope I don't have to get surgery because that's not going to be good for nothing. But it's going to be okay if I do, but I'm praying I don't have to get surgery. Like, that is not the news that I want to hear. But my range of motion on this arm, so this is my range of motion on my right arm. And let me show y'all. So I can do this with my right arm. I can go here. I can go behind my back. I can go straight. I can go here. But this arm, some kind of way, it got injured. I could go about here. I can't go behind my back. And as a dentist, these are my pride and joy. My hands, my arms. But I didn't think about my shoulder. I didn't think about that. So that's what I'm dealing with right now, and I don't know how that's gonna work out. But if I have to get surgery, I'm gonna cry like a baby for probably a day. That ain't a word you want to hear. Has anybody ever had like a rotator cuff surgery? How long did it take you to heal? Because I've been dealing with this injury. This is like almost the 4th or 5th month, and it's not getting better. I thought that it was gonna go away by now, but it's not getting better. Not getting better at all. So how many of y'all have dealt with that before? How many of y'all dealt with that before? So, because I don't really have a topic and I want to talk about something, it's always easy for me to talk about teeth. So let's see. Let me pull up something. Where are my notes? Let me find my notes, guys. No, that's not what I wanted. Where's my notes? Where's this one at? I can't find my notes on that, but let's see. So, as far as teeth is concerned, next year it's gonna be kind of tough to get into the dentist if a lot of dentists start to go out of network. And I mean, with this recent United Healthcare scare, there's a high chance that a lot of dentists like myself probably gonna go out of network because it's too much of a hassle to deal with that. It does not make my job fun. But while we are on here, I'm just looking up something. Dental. Top 8. Doo-doo-doo. So, what are the top? Since I'm on here, I'm just gonna talk about teeth for a minute. What are the top 12 common teeth problems? What are the top 12 people have teeth problems? Like, what is the top reasons for people having pain and discomfort and all of the symptoms that we as dentists deal with? You know, and these are often problems that can be prevented, especially if you are brushing every day, flossing every day, eating a healthy diet, and going in for your regular 6-month checkups. This is going to help you avoid that tooth decay, that tooth erosion, abfractions, sensitivity, infections of your gum, your teeth, or your root. So you definitely want to make sure you are going into the new year taking care of your smile. All right? That's important. Educating yourself about the common dental health problems can really help you and prevent you from having those expensive dental bills that we all fucking hate. If I could just be frank with you, we all hate it. So let's talk about the 12 most common dental problems. And like I said, feel free to interrupt me because I'm just chatting about something random until I get questions in the inbox, in the chat, or, we ain't got to talk about teeth. Y'all can talk about whatever. But I'm here. I'm live, and I'm not going nowhere right now. The 12 most common dental problems. What do y'all think the most common dental problem is? Like, number one. Can I get somebody to just take a guess? Just one person. What is the most common dental problem that you think people have? It's not that hard. Just think. What would you think would be the most thing that people deal with? I'll give you guys 30 seconds to see if I can get an answer. Just think about what is the problem that most people have with their teeth. Do 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 All right, time's up. So the most common problem that people have with their teeth is halitosis, aka bad breath, which can be very, very embarrassing for some people. Studies say that this dental condition is to blame for about 85% of people. Okay, with persistent bad breath. Um, you know, well, a dental condition is associated with 85% of people with bad breath. That means if you're dealing with halitosis and you're trying to figure out why, 9 times out of 10 it's related to your teeth or your gums or something in the oral cavity. And these can include gum disease, cavities, oral cancer, dry mouth, and bacteria on your tongue. Okay? Now, if you're trying to use mouthwash to get rid of this issue, it's probably not going to work. To really get rid of chronic halitosis, you really want to see your dentist because gum disease, this is an infection in the gums and it lingers to the bone and it causes gingivitis, periodontitis, periodontal disease, or even cavities. This is your tooth decaying or rotting. It's like fruit or any type of food. If you leave it on the stove for a couple days and you don't get rid of it, what happens to it? It gets old, it starts to grow mold, and the bacteria start to destroy it, and it turns into something that's very smelly that you don't want to eat. The same thing happens with cavities. If you don't fix them, they can get bigger, they can turn colors, they can spread to other teeth, and they can cause halitosis. All right? Oral cancer, this is something that can also be related to having an odor in your mouth. With oral cancer, some patients are like, hey, I didn't know you could get cancer in the mouth. Yes, you can get cancer in the mouth, especially if you smoke cigarettes, tobacco. You could definitely get cancer in the mouth. So just be vigilant on that. If you notice anything strange in your mouth, get it checked out. Even if you have to go to the emergency room to get it checked out because you don't have the funds, get it checked out. It could potentially save your life. All right. And then your tongue. How many people brush their tongue? How many people actually spend the time to brush the tongue? The tongue is the home of the flavor. That's the flavor station. This is where you getting all the flavors popping: the sweet, the sour, the bitter, the your mama. This is where you get all the flavors. So brush your tongue. Get a tongue scraper or just use your toothbrush, but make sure you are brushing your tongue. These are tips that can help you get rid of bad breath. But with the cavities, the gum disease, the oral cancer, you will have to see a dentist for that. As far as the dry mouth is concerned, that could be related to your medication that's causing dry mouth. That could be related to certain conditions that cause dry mouth, like scleroderma. So, a lot of these things can cause you to have halitosis, and that's not cool. All right. So the second most common condition out of 12 would be tooth decay, which is, everybody knows about tooth decay. All right. And it's really, really prevalent in people who lack access to oral health care. All right. Whether that's through finances or, where they don't have access to a dentist, or I don't know. There's a lot of reasons why people lack access to regular oral health care. Okay. So we talked about tooth decay a lot on this channel, and that happens when plaque combines with the sugars and the starches you eat, and they produce acid that attack the tooth enamel. So the bacteria plus the sugars that you eat, they produce acid, and then it makes your enamel, it destroys the enamel, which is the hardest substance in the body. And even little kids can get cavities. Okay, you can get cavities at any age. It impacts kids too. So a lot of kids walk around with toothaches, and they have to go to school with a toothache, and they're crying. The parents give them candy and sugar, and they go to trick-or-treating, and they eat all this candy. They don't have good oral hygiene, and then they end up with silver teeth and have to get put to sleep. It's so traumatizing to a kid sometimes, to go through that. So why not prevent it? Why not avoid the tooth decay? Aging and normal enamel erosion can also cause cavities as well. All right, so you just want to make sure you are brushing and flossing. Dr. Sean, you always tell us to brush and floss. Yes, brush and floss your teeth, brush your tongue, and get those checkups. And if you are a candy eater, soda drinker, you like little Debbie cakes, and you don't like that little toothbrush, then you're going to have some big cavities. And they not gonna play with you. How many people know that cavities do not play? When they come to the party, they finna turn up in your mouth. They finna come in here with a vengeance, and you gonna feel like, what the hell? I don't ever want to feel this again. I don't ever want to have a toothache again. It just like changes your life if you get a toothache. It's like, Lord, those little bitty teeth can be so damn damaging. They can be so damaging. And I'm just here to let you guys know. I'm just here to let you know. The third thing that is one of the most common things that people complain about to the dentist, or the most common dental problems, is going to be gum disease or periodontal disease. Hi, Dr. Smiles. Can I ask a dumb question? There's no such thing as a dumb question. No such thing as a dumb question. Can I ask you a question? Are pet teeth similar to humans? I rescued a dog and she has bad teeth and breath. Yeah. They're not the exact same because dogs have a different diet. Dogs don't eat candy. They can't brush their teeth. Dogs can't floss their teeth, but they're very, very similar. So dogs have to get cleanings too, but a lot of dogs, you need a good owner. You need a good doggy owner to really know that the teeth are important, because they can have issues too. But dogs can't do what humans can do, and I feel like that's why they have like little chewy sticks that dogs can chew on to kind of clean their teeth. And I read something the other day where they said a cleaning for the dog is almost $500 to get the doggy's teeth clean. I'm not a pet owner, but that is crazy that dogs and humans, like the price with the teeth cleaning, is kind of crazy. So the differences between dog teeth and human teeth, these are some differences that maybe will answer your question. So the size and the shape. Dog teeth are notably sharper and more robust than human teeth due to their carnivore nature. Like, they like to eat meat. Well, they're a little bit more aggressive. So their canines are going to be a lot different than a human teeth canine. So our canines aren't as sharp. Y'all probably can't see my canines, but they're not like fangs. Dogs have pretty much like fangs. So if a dog bites you, you're going to need to go get a rabies shot. Dogs have 42 teeth, okay? That's 10 times more teeth than humans. So we have 32 adult teeth. Normally, dogs have 42 teeth, so they have more teeth. Like humans, dogs also have two sets of teeth. They have deciduous teeth, which is baby teeth that fall out, and permanent teeth. Now, that's kind of crazy, right? That's really crazy. So that is a good question. Thank you for asking that question. I think the doggy owners would like to hear that. Another thing that I'm going to talk about with the doggy teeth is their cavities. Let's see. I'm not a veterinarian, but I am a dentist, so any kind of teeth kind of entice me. We already just talked about cavities, but cavities in dogs. So I'm on this website. It says the only symptoms are visual appearance of cavities themselves. So it's important to examine your dog's teeth regularly and bring them in for dental checkups. That's crazy, right? So if you love your pet, make sure you are taking them in for dental checkups. And just like the dog that you found, they probably had cavities and halitosis because they had, something happened where their teeth just weren't taken care of. The most common site of cavities in a dog is the pit of the top and bottom maxillary first molars because it has a deep groove, kind of like our teeth. Our teeth have pits and fissures, and that's the number one spot where we get cavities. So think of it like your tooth. You know how your teeth are shaped. The molars are in the back, so they have little pits. You know what a pit is? It's like a little dip. So this is a place where food can get packed in that little pit, and you start a cavity if you don't brush it out. And a lot of people don't brush that good. So this pit is where you're gonna likely get those cavities that's either spread and go wide, or they go right down to the nerve. And this is saying that dogs' teeth are very, very similar to that. So it says when you hold your dog's mouth open, the first maxillary molar is the second to last tooth in the back. So this is the back teeth. Okay. Cavities, it says cavities in dogs look similar to human cavities. So they're going to be dark, they're going to be brown and discolored. You know how enamel is white, so their enamel is going to be white, but when it has an issue, it's going to be dark. But my thing is, I don't think a lot of people are wanting to go into the dog's mouth and check for cavities, because even though this is your pet, you know, some of these dogs still gonna bite you. They don't want you to open their mouth, and you know, so if a dog got a cavity, they're probably always gonna have a cavity unless they have a great owner, period. Because if I had a dog, I'm never thinking about like opening up the dog mouth to check for cavities, even though I'm a dentist. All right. So it says there's two different types: incipient cavities, which are the tiny ones, it's like a dull spot on the enamel, and then you have the bigger ones, which are dark. Now, great question, by the way, and I'm gonna just keep going with this because I think it's very interesting, and this is why you guys ask me questions, because I like answering questions, even questions that I don't know. I like to find out. So it says the development of cavities in dogs, kind of like humans, is poor oral hygiene, because a dog can't brush their damn teeth. They can't brush their teeth. So if you go to the store, I see a lot of little on the doggy or the pet aisle, even like PetSmart, any of the pet stores, they have little like doggy bones that are meant to help with the dental, or you know, help clean their teeth. So there's things like that you can get to kind of help your dog. If you don't want to pay $500 for a cleaning and you're concerned about it, you can definitely go to the pet store and see what product they have to kind of help them clean their teeth. So poor oral hygiene, so get them the doggy bite sticks. I don't know if you brush the dog teeth. I don't think so. That might be dangerous. Poor diet. So this is poor quality dog food or excessive feeding of high carbs like table scraps such as bread. I didn't know that. I didn't know if you give your dog a lot of scraps with bread in it or just poor quality dog food that could cause a cavity. But I guess it makes sense because just like we talked about earlier with humans, if we're eating a lot of sugar, candy, stuff like that, it's going to break down into those fermentable carbohydrates that bind with the plaque and create acid, which is going to destroy your teeth. So if you're giving your dog bad food, then they're going to have bad teeth. Poor overall health of the dog can be a cause. So, you know, different breeds of dogs have different health issues. So certain breeds are going to have more issues than other breeds. If their teeth are formed really close together and they don't have any gaps. So with the doggy teeth, they're not like ours. You see how our teeth are mostly meant to be like together, which is why you have to floss them. Dogs' teeth aren't really together like that. So they don't really have that space where food is getting stuck. But sometimes they can have teeth that are closer that will cause them to get stuck. All right. Low salivary pH and poor mineralized tooth enamel. Only your veterinarian would know about the quality of your doggy teeth. So the last thing I'll talk about with this topic is just what dogs are more likely to have dental problems. Okay. Some small breeds and breeds with short faces are predisposed to dental problems. So let's see if your dog is on the list. Brussels Griffon. I don't know what kind of dog that is. English Bulldog is on the list. French Bulldog. So these are the shorter dogs. A Shih Tzu. A Lhasa Apso. A Pug. Chihuahua. Pomeranian. poodle, toy, miniature, and full. The poodles be having a lot of issues. Dachshund and a Yorkshire Terrier. So those are the doggies that you really want to, you know, monitor for those issues. Shih Tzu. Yep, they have issues with their teeth. So it's going to be important to take any of those dogs to the dentist because, you know, those are kind of like more expensive dogs. So if you got one of those dogs, then you got to have the money to kind of take care of them, including their teeth. Now, another question that I would have is like, how often do dogs need a cleaning? Because, you know, we need our cleaning every 6 months. I don't know if you're paying that $400 every 6 months. It says most veterinarians recommend that dogs should have their teeth cleaned 1 time per year. Okay, this can depend on the breed, and you know, sometimes you can get it done less often. So it's good to have a vet if you have a pet. I like that. It's kind of like it's good to have a dentist if you have teeth. It's good to have a vet if you have a pet. Woo, on fire. I'm a little corny like that. But great question, Anthony Wiley. I learned something new today. And it's a great day when I can learn something new. And I like learning something new every day because I don't know. The biggest thing about life is that, you know, how can I put this? There's so much to know that I barely know anything. It seems like I know a lot, but I barely know anything. So I'm always looking for new things to learn. You know what I mean? So back to our list of 12 common things that were 12 common dental issues that people can have. So we talked about halitosis, which is bad breath. We talked about tooth decay, which I'm always talking about tooth decay. And we talked about gum disease or periodontal disease, right? So, no, we didn't talk about periodontal disease. That's what we were on. So, gum disease, periodontal disease. This is a major cause of tooth loss in adults. And a lot of studies show a link between gum disease and heart disease and other conditions. So, your gum health is directly related to your heart. And a lot of people don't know that. The things that's going on in your mouth can cause more issues with your heart. It can cause issues if you have diabetes. It can cause, excuse me. This little cold still trying to mess with me. It can cause issues for a lot of things, guys. A lot of things. And everyone is at risk for gum disease, okay? But when is gum disease more of an issue? It's going to be more of an issue after you hit the age of 30 years old, okay? And significant risk factors for gum disease is going to be smoking. And like I mentioned earlier, diabetes. And something we talked about earlier, dry mouth. Now, how do you know if you have gum disease? What are going to be the signs? What are going to be the symptoms that you can look for if you aren't going to the dentist and they're diagnosing you with gum disease? The signs and symptoms that you're going to have is the one thing we covered first, which is bad breath. Because think about it, with gum disease, this isn't like an infection in your gums. So your gums support your teeth, and the gums and the teeth, they have a little, they join like this. So this is the teeth, this is, well, we'll say this is the teeth, this is the gum surrounding the teeth. Yeah, that's a better example. All right, so this is the tooth, this is the gum, right? Nah, I don't like that example. This is the tooth, this is the gum, so they stick together. If you get gum disease, you'll notice like the gum starts to disintegrate off of the tooth. You get little pockets that open up. So with this pocket that opens up, what can happen? You can get food down here, you can get bacteria, and then if this continues and you don't clean it out or you continue to let it advance, then eventually the gum and the teeth separate and then you get tooth loss. That's the easiest way I can describe it. You get tooth loss. Even without the cavities that we talked about earlier, even without, like, you know, Even if it's like a perfectly cavity free tooth, if you have gum disease, you can still lose your teeth. Because think about it, if you don't have the bone that's really tight on the tooth, like gripping the tooth to keep it in, you see how your teeth are in your mouth? Gum disease causes that gum or the bone in the tooth to kind of separate, and then you get mobility. So your teeth start to move, and then once they start to move, guys, it's pretty much a wrap for the tooth. Even if you don't have cavities, it's like you're saying goodbye to a perfectly good tooth because of the gum disease. And the signs of this is going to be bad breath, tooth mobility for sure, swollen, bleeding gums. Like if your gums are very sensitive and sore, and you having pain eating and chewing, you got something going on with your gums. And if you don't get it fixed, it's going to get worse, a lot worse. All right. So, whenever you have the issue where it's just your gums, this is gingivitis. So, this is the swelling, the redness, the irritation. But if this starts to impact the bone around the tooth, this is called periodontitis. So, this is bone loss now. And this is a more aggressive form of, disease in your mouth. Moving on from that, the next thing that is very common that people don't think about, and I mentioned it earlier, is oral cancer. Oral cancer is very serious and is very, very deadly. It affects millions of people in the United States, and it's most common after you hit the age of, take a wild guess, after you hit the age of 40. This is when you're going to have issues with like oral cancer. Okay. It says someone in the U.S. dies of oral cancer every hour. Every hour someone is battling this. And just from a provider's perspective, I've had several patients in the first year of opening up this dental practice. I've had several patients, probably at least 5, who have battled oral cancer. And it's one of the things where it comes so fast, and it's a very aggressive form of cancer. Once it starts in your mouth, if you don't catch it, it can pretty much kill you. It can make you lose your throat, your tongue. A lot of the patients, they end up having feeding tubes, and they end up speaking through a voice box through their throat, or they can't really talk anymore. And it's so heartbreaking. Like one of my very first patients, he was in prison, and he got diagnosed with this in prison, and they didn't really do much for him in prison, but he got out, and even though the insurance didn't cover what he needed, I still did it because it just hurts to see people dealing with such an aggressive form of disease, and it starts to make their throat swell up down here, and it's just so scary. It's very, very scary, and it happens so fast. So that's why being aware of these things, even though it may seem like something that's not really a fun topic. It might be, maybe it's not like a topic that is popular, but I feel like it's a topic that is needed. So that way, if you have someone in your family, or even yourself, if you are a smoker of cigarettes, or even if you don't smoke, if you drink alcohol, or if you had a history of HPV, human papilloma virus, poor nutrition, even your genetics can put you at risk for oral cancer. All right. It's curable and it's treatable, but you have to catch it when? Very early. Very early. Very, very early. So how would you know? Like, what would be the signs and symptoms if you had oral cancer? This is going to be lumps in your throat, sores in your mouth, changes in your bite. And one of the main places that oral cancer starts is under your tongue. So that's why every patient that comes in the office is supposed to get an oral cancer screening. Now, I went to Meharry, so I'm a Hairy maid, and they don't play about you skipping your oral cancer screening on your patient. So this is something that I have done on every patient at every exam, and I do not skip it. And I do find things, and when I find something such as swollen lymph nodes, or weird lesions under the tongue, or anything that's suspicious, we got to get a biopsy and see what is going on. But you will be surprised how many patients I hear say that Oh, the last dentist never did that on me. And I don't know if they never did it or they just didn't tell them, but they're like, I never had that done. And this is like a lot of patients. So 9 times out of 10, the dentist probably isn't checking for it because they're in this little fast routine where they're just looking for cavities, looking for that money. But you want to make sure your dentist is checking for that. Okay? Don't let them skip the process because they might not be Mahari made. And if they ain't, I can't vouch for them if they ain't Mahari made. I cannot vouch for them. No, I'm just kidding. But just make sure they check for that. Okay, so regular dental visits is going to be a way for you to check for that and, see if you have any issues. The next common thing, number 5, is going to be mouth sores. All right. There are several type of mouth sores, and usually they are self-eliminating, meaning they go away on their own, but sometimes they can last a few weeks. And they can be confused for some type of oral cancer, but these don't cause your lymph nodes to swell. They actually go away. Can medication cause your teeth to either become more sensitive or start to decay? Absolutely. Absolutely. Medication can cause so much problems in your mouth, like so many problems, like the dry mouth that we talked about. Certain medications can cause dry mouth. They could just do so much damage to your teeth, and a lot of people don't know that. Okay, some anticoagulants commonly prescribed for heart and stroke prevention, they can cause excessive bleeding. There's so many things can cause issues for your teeth. And like gummy vitamins, these things have added sugar, so they can cause cavities like that. But just a lot of the medications can do damage. So that is a very, very, very good question. Very, very good question. So yeah, you want to make sure you are telling your dentist what medicines you take, because that's going to help them diagnose if you're having issues with dry mouth or excessive cavities. And you tell them, hey, I'm taking this medication, they're going to be able to link that. So examples of some medications that can cause tooth decay by causing dry mouth and gum disease, or increasing the risk of gum disease, are antidepressants. So how many people out there are taking these antidepressants? That's pretty much a lot of people are taking antidepressants. Antihistamines, these are like the asthma pumps and things like that you spray in your mouth. These can cause cavities, dry mouth. Aspirin, that's another one. Clonidine, atropine, antacids, and cancer treatments, especially cancer treatments. I don't know if you ever knew anybody with like cancer, but whenever they have cancer, just like we talked about with the oral cancer, the doctor will give them fluoride trays to kind of protect the teeth, because the medicine is pretty much poison. So it does so much damage to your mouth. So much damage. That is a very good question. Okay. So common mouth sores that you might experience. I know I've had like a little sore from cutting my gum with a taco chip. Is canker sore, fever blisters or cold sores, and thrush. And I know the mamas out there know about thrush. So canker sores or aphthous ulcers, they occur in your mouth and not on the lips. They aren't contagious, and it can be triggered by many things. Fever blisters or cold sores, which some people get, is caused by herpes simplex virus, and they occur on the outer edge of the lips, like sometimes down here. And they are contagious. They come and go, but they can be cured. But if somebody has a little cold sore, you do not want to be lip kissing them. You do not want to be all up in their grill like, because you're going to have a cold sore, boo. You're going to have a cold sore, and you're not going to be happy. I'm like, where did I get this damn cold sore from? Thrush. Thrush is a yeast infection with sores in the mouth, and it can occur. It can occur. I can't even talk with this stuffy nose. In infants, denture wearers, people with diabetes, and people who are being treated for cancer. So candidiasis in infants is because they're drinking on the milk. and they get that little white spot on the tongue. If you have dentures, you can get this same condition from wearing your denture. If you have diabetes, you can get it, and if you're treated for cancer, okay? So you definitely want to monitor that. Number 6 is tooth erosion. Tooth erosion is a loss of tooth structure, and it's caused by the acid attacking the teeth, okay? So, not really super serious, but it's a common problem that people have. Number 7, teeth sensitivity. This affects so many people, including myself. I did whitening a couple years ago. I only did it once, and I'm not really a super fan of getting your teeth whitening, just because it creates unnecessary sensitivity. So unless you just dying to have white, pearly white bleached teeth, know that it's gonna come with some sensitivity. So every now and then, even though I got my teeth whitened with like a at-home tray years ago, I get a little bit of sensitivity. So that is definitely a problem that affects a lot of people. And some people get this sensitivity for a whole list of reasons. Sweets can cause sensitivity. Me and Snickers don't get along. Cold air can cause your teeth to be sensitive. Hot drinks, cold drinks, ice cream can cause sensitivity. But even cavities, if you have cavities that are starting, or issues with the gum like recession, this can cause your teeth to be sensitive as well. So you just want to talk to your dentist about it to make sure that the tooth doesn't have an issue like cracked tooth or abscess or something like that. All right. Number 8, toothaches and dental emergencies. This is a very common problem. You would think this would be the most common problem, but this is number 8 on our list. And this is something that requires urgent care, like immediate care. You'll know if you have a toothache or a dental emergency because you're going to be in excruciating pain. If you have a cracked tooth, a broken tooth, an abscess, like a bubble on your gum, if you get your tooth knocked out because you've been out here like slaying like Clarissa, you been out here knocking people out, then you might get your tooth knocked out, then that's an emergency. There's a lot of different things that cause dental emergencies. For me, I would say the number one thing that causes people to have dental emergencies is ignoring your dental care, ignoring your oral hygiene. A lot of people do this. They ignore their oral hygiene, and then they expect the teeth to take care of themselves, and that's just not how it works. It's kind of like a garden. If you go out here and you plant the seed, and the seed starts growing and it doesn't get water, it doesn't get sunlight, it doesn't get the nurturing that it needs to grow, then the plant is going to die. This is the same way your teeth are. If you don't floss them, if you don't brush them, if you don't just do those basic things, which a lot of people don't do, and they come in and they have this pain, and we have a long talk, and I change their mind like, hey, this is important. Like, even though your gums are sore and bleeding when you floss, you still have to floss. The bleeding is a sign that you're not flossing. It's not a sign that you don't need to floss. And a lot of people have it backwards. They're like, well, when I floss, my gums bleed. Well, you need to continue flossing. And they're going to be sore because you don't floss every day. They're not used to being clean. That's kind of crazy, right? When your teeth aren't used to being clean and you try to clean them, they get sore. Because that's your body healing. That's your gums healing, trying to get rid of the infection, okay? Number 9 reason that is a common dental concern with people is an unattractive smile. It's not really a problem, but with dentistry, we are in the industry of giving people more attractive smiles and making people feel confident and happy with who they are so that they can go in the public and go to work and just smile and not hide their teeth in pictures. A lot of people have low self-esteem when it comes to that, so I feel like dentists in that field, in that regards, we have a heavy task on our hands just to help people change the cosmetics in their life. This can include whitening like we talked about earlier, but you know how I feel about whitening. This can include dental implants. Okay? So how many have dental implants out there? This could include braces. How many people have did braces or clear aligners and it has changed your life? I was just talking to a young high school student on Twitch. I was it yesterday or the day before yesterday, and they just got their braces off after 6 years. They were in Switzerland, and I'm like, that must be exciting. They were like, I feel like a whole new person. And that's how teeth can make you feel. It can make you feel like a brand new person. Like you just like, you get your swag back, you get your back, you get your confidence back, your self-esteem back. Now how important is that? You know, period. Veneers, they get your, crowns, bridges, veneers. There's so many things that a dentist has in their toolkit to get you right. You just can't be afraid, which is most people are just afraid. They just afraid. They like, you know what, Dr. Sean, I hate the dentist. I don't want to go, even if it means I'm gonna have a bear. I just don't like y'all. I don't like you. They be like, I don't do you. I ain't you personally, but I just don't do y'all. And I get it. But your teeth need us. So don't deny your teeth the care that they need because you are afraid. Now, some people have a reason to be afraid. I've worked in a couple offices where the dentist was more like, I don't know, like Michael Myers or something, like just mean, like rude. And you'll find a lot of dentists who are in the straight, like taking Medicaid and stuff like that, where they have to work super fast. They can get really mean to patients. I was working for a provider, one of my first dental jobs, not my first one, but one of the first ones. And this dentist, I kid you not, he was mean as hell. I almost wanted to come across the thing and just smack him for talking to people crazy. Open up. Be quiet. Shut up. Now, that kind of thing right there, do not ever let a dentist, like, talk to you like that just because they holding the drill. Listen, there's a dentist out here who would treat you better so that you don't have that dental anxiety. I've heard some horror stories from people going to dentists who have kind of lost that kindness. They've lost that care and compassion for people, and they picked up that, and then they just like, hurry, I gotta get the dollar. Shut up, hurry up. I'm up fresh out of like school. I'm like, is this man really talking to them like that? Like, he was just rude. Like, some dentists are just rude. They just rude, you know. I even had a dentist tell me, like, try to get slick. Hey, sir, we got the same degree. Just because you a little older than me doesn't mean you get the, no, we got the same degree. Okay? Pipe down, because I'm not the one. But anywho, back to the unattractive smiles. So that's number 9. Number 10 is going to be root infections, like a, infection at the root, meaning you would need a root canal. Okay? So this kind of problem develops when you have a cavity or a tooth that is not treated properly, and the bacteria just goes down, all the way down, past the gum, past the bone, all the way down inside of the tooth. It can go all the way down and cause infection. And then this is where you get those large abscesses. The abscesses that can kill you. They're full of pus, and if you don't get them treated, they just get worse and worse and worse. It's highly unlikely that if you have a issue with your tooth that is causing 10 out of 10 pain, that you're not going to go seek treatment. A lot of people, they fall into the trap of, okay, I have a tooth infection, let me go to the ER. They're going to give you some antibiotics and some pain medicine. It kind of takes it away, and you end up in this cycle of never truly healing the tooth or never getting the root canal and crown for a host of different reasons. We don't judge, but it causes you to eventually lose the tooth in a painful way, a very, very painful way. So many people are afraid of root canals because sometimes they don't always work. Sometimes they don't always get rid of the infection. Research shows that 76.7% of root canals completely heal. So that doesn't mean they always, heal. And I like to tell my patients, because some people will come in and they're like, well, I don't want to get this because I heard bad things about it. Like, I had a patient where her insurance was 100% paying for the root canal, which is unheard of. And she was so scared. And she's like, I don't know. I don't want it. It was a easy root canal too. I'm like, listen, if I were you, I would do this. I would not just take this tooth out because you're going to regret it. So I had to kind of coerce her into getting this procedure done. And she was so happy after that. It's nothing like saving your tooth and still having your tooth there versus this big gaping hole that you now have to get either an implant or a partial, or you just leave it how it is. So don't be afraid of root canals, but also know there's risk with everything that dentists do. Sometimes it doesn't work. Most of the time it works, but just like anything, it's going to be a risk. It's also a risk if you just leave a rotten tooth in your mouth. It's also a huge risk. Probably a much bigger risk for you. Okay. Did we have a comment? Hi, Priscilla. How are you today? How's it going? I'm just on here chit-chatting, running my mouth for a little while. All right. We got 2 more issues to talk about, and then we'll be done with the top 12 common dental issues, which a lot of people who watch this on the replay, you're probably gonna be like, yeah, doc, I have some of those issues. I know I've had some of these issues on the list. So the teeth, if you have teeth, which is a lot of people, it affects all of us. But the one thing that's not really talked about is oral healthcare, oral hygiene, which is why you have me to help you get to the spot where you appreciate your smile and you don't want to let it go. You don't want to be where I'm gonna lose them anyway, so I'm just gonna get dentures. No, don't think like that. You need your teeth, okay? Anthony says, nothing worse than military dentists that pull all of my wisdom teeth while I was awake. Passed out in the chair, LOL. Woke me up slapping me in the face saying, don't do this to me. Worst experiment before deployment to Southwest Asia. This was Fort Dix, New Jersey. Oh my gosh. You can't make this stuff up. See what I'm saying? I know a lot of you guys have stories like that where you had a dentist. And I'm sure those military dentists, I don't want to talk about military dentists, not all of them, but some of them have that aggressive, like, militant mind, like, hey, soldier, open up, like, that's kind of scary. Like you said, it's one of the worst experiences when you have a provider in your personal space. Like, dentists have to get all up in your grill, literally. They have to be all up in here, like all up in there. They have to be all in your face, and it's nothing worse than having someone all up in your face trying to help you fix your teeth, and then they got an attitude behind it. They got like aggressiveness behind it. And then once they give you that anesthesia and you open wide and they start the procedure and they flip on you and they turn into like Michael Myers or something, it's like, dang, I'm stuck here. I need to get this done, but this person is being so rude, and it puts patients in a bad spot, and I really hate that. I really, really hate that. I really, really don't like that. And that's why the dentist that I work for who was like that, I didn't stay long. I had to leave because it was ridiculous. I couldn't believe it. I had never seen that at my school. I never saw that in my dental residency. I just didn't know that dentists were like that. I thought that dentists were supposed to be one of the nicest people on earth. But what did I know from patients? And like you just mentioned, having someone, give you the worst experience of your life. Like, that's crazy. Like, and I'm sorry you had to go through that, but it's unacceptable. It's totally unacceptable. So to you mean dentists out there, you don't need to be a dentist. That's all I got to say about that. You need to find you another career where you can go and, I don't know, what kind of career would that type of person need? Definitely not a career where you're interacting with people in the public. So number 11 is teeth grinding. So I know a lot of people deal with grinding of the teeth, and especially recently, like this year, with all the inflation and the high prices and the government going berserk and all of the things going on right now, TikTok shutting down, all this stuff going on, all this stuff, people are stressed. One of the things that causes grinding is stress. Okay? Stress. So teeth grinding is also known as bruxism. It happens when you grind your teeth together I can't even lift my arm up. Listen, when you're grinding your teeth together at night, like this, and it wears down the enamel, it wears down the cusp tips, it just causes you to have flat teeth. So if you go to the dentist and they notice that your teeth are flat, they're probably going to say you need a night guard or something to prevent that. And a lot of people don't even know that they're grinding their teeth, but it's exerting hundreds of pounds of forces on your teeth and your jaw, and this can cause issues. It can cause you to crack your teeth. It can cause flattening of the jaw. It can cause neck pain, jaw pain when you wake up in the morning. It can cause headaches when you get up from sleeping at night. If you feel tired, like you've been working or your face is achy, then you might be grinding your teeth at night. Okay. So like I said, your dentist will give you like night guards to help with this. And if you don't want to go to the dentist for this, you can get over the counter night guards. They may not work as well, but if you feel like you're grinding, that would be a good place to start. Go to like CVS or Amazon or somewhere and get you a little over the night a night guard to use and over the counter. And if you chew through that one, then you really need to kind of get you know, a professionally made night guard, which are going to be a lot thicker, a lot tougher, so you're not just chewing right through it, because that will damage your teeth. Some patients have ground down their teeth so far that it's almost to the nerve, and this is when it becomes dangerous to the point where you might need a root canal. Okay. And like we said earlier, stress is a major trigger for grinding your teeth. So you want to definitely de-stress, do some yoga, try to figure out, get a therapist or something so that you're not stressing. It's kind of like you see those people who lift heavy weights and how they like clench their teeth and grind their teeth like, ugh. It's kind of like that, but you're actually, you know, grinding your teeth. And sometimes people do it during the day. Which brings us to our final common issue with teeth is TMJ, temporal mandibular joint disorder. TMD, TMJ, you know, this is when you have issues with the joints that like move your jaw. So let me see, like this joint here, if you put your hand here, you can feel it. So a lot of people lose the cartilage around the joint and the cushioning around the joint, so it becomes achy over time. All right. And this is something that you kind of want to see the oral surgeon about, to kind of see what they can do to help you with that problem, because you can have problems swallowing, yawning, talking, chewing, and it could be an issue. So, you know. All right. So that was a long list. Now I hope you guys got some good information from that list about teeth. Yeah. But great questions. Thank you, Mr. Wiley. And you're the only one really asked some good questions. But thank you for the wonderful questions. We learned about some dog teeth. We learned about a lot right now, an awful lot. So while I'm just chit chatting on here, let me. What is this? Show in horizontal. Show in horizontal. Hide from vertical. Show in horizontal. Alright, why my window capture ain't working? Where's my window? There we go. Yeah, so I'm just chilling on here, guys. Like I said, I'm streaming from Twitch. And the other day, I did a long time on here. Monica, how are you today, beautiful? I just been on here talking about some teeth and stuff. Right now, I'm trying to get my game pulled up. It's not working. There we go. There we go. How you feeling today? Are you off? Are you working? What's good? Always happy to hear from you. There we go. So I'm gonna play solitaire while y'all pop in and out. Tired, but all is well. I'm happy to hear that. Same here. All is well with me. Feeling much better. Just getting over a cold. You can kind of hear it in my throat a little bit. And dealing with a shoulder injury, but you know, what can we do about it? You're working tonight? No. Well, I hope you have a good night at work. I remember doing those overnights while I was in college, working at the hotel. That was probably one of the best ideas I had as a college student, was to get a job at a hotel. Because I'm telling you, I had a supervisor. I don't know why this is over that. Let me move this off of my TikTok screen. Sorry, TikTok. I had y'all blocked. But that was one of the best jobs I had as a student, is an overnight job. I used to sleep. I used to go to her apartment, which was behind the office, and eat. Like, I would do my homework, study. It was just the best idea. So if you're a college student and you can get a job at like a nice little hotel, that's a hack, guys. That's a hack. That is truly a hack. But yeah, I don't know what I'm gonna do about my shoulder. That issue is, I don't know. I don't know, y'all. It's kind of hard to be a dentist with a broke shoulder. Not a broke shoulder, but an achy shoulder. You never think about the injuries that come with doing teeth. At least I didn't really think about it. But yeah, like I said, when I first started this, I just try to be positive about it. If I have to get a surgery, it is what it is, you know. Health is wealth, they say. It is, but I don't want to do it. It reminds me when I had to get a surgery. My said, "You're looking good. Thank you." I decided to get out of my little sick mood and laying down and get myself together, do some work, try to get back into the flow of things and tidy up some things before the year ends, you know. Because this year is almost over. And I am not setting any New Year's resolutions. Nope. I'm going to let it do what it do, boo. Man, that's got to be crazy. Get a second opinion, please. Yeah. It's not officially surgery yet. But knowing that it's taking 4 months to go away. And I'm only like here with my range of motion. I gotta lean back to get there. So it's like, if I go any higher, like, oh, it just hurts so bad. Oh, and then if I do that, it just like it just lingers. Why did I just do that? No. But that's what's going on with me. Oh, and it just hurts for like 10 minutes once I do that. So I've been watching like YouTube videos to try to get my range of motion back, but it's not looking good for the doctor. But we gonna stay positive, and hopefully we can do intervention that doesn't require me to take 6 months off of work. Like, yeah, physical therapy. Um, yeah, physical therapy. I've been trying to do that, but you know, I don't know, y'all. If that happens, I don't know. I don't know. We gonna pray that it's not that. We gonna hope and just, whew, hopefully that ain't the case. It's like I said, I had to go through surgery my senior year of dental school unexpectedly, and it was terrible. Like, I missed all my senior stuff, like all my senior activities on bed rest. This is the last 2 to 3 months of senior year. Like, all, you go through dental school, you work hard for 4 years of just studying and studying day and night like a crazy psycho. I mean, you study all day, all night, all day, all night. You go to class all day, all night, and then you get to your senior year, or I'm saying senior, you get to your D4 year, and all you can think about is getting to the finish line, um, celebrating with your peers and your classmates and your, you know, professors, and partying and going to the Carabelli ball and all these balls and partying. That's all you think about because you've been deprived of it for 4 years. And then you get to your last semester of the D4 year, and to get here that, hey, you got to have an emergency surgery. And I'm like, no, there's no way that's going to happen. I'm finna finish my semester out. I'm almost done. No. And I told the doctor, no. And the doctor said, hey, you have to do this. Otherwise, it's life threatening. This is January of my D4 year. I'm like, what the fuck? So, January of my D4 year, bad news. I had my surgery around February, and I was on bed rest, and it just ruined my whole semester. So, me and surgery, I'm not looking forward to that. And I think that, like, if I did need surgery, like a rotator cuff surgery, I don't think it would be as invasive as like a feminine surgery. But at the same time, I've been looking at the research on it and the healing time, and I'm like, 6 months? There's no way. So yeah, aqua therapy will help. I will definitely look into that. Aqua therapy. That's like in the pool. Water therapy. So yeah, that's my next thing, is just to continue doing the physical therapy. But I do have an appointment with like an orthopedic surgeon, just to see like my options other than surgery. Um, I'm I'm really hoping, but I can't control it. But I know that I can't function the way it is now. My range of motion is probably 50% on this arm. Um, Healing from the inside takes a long time. Monica, I didn't know. Yes, hot tub and regular pool. Oh, that's some good advice, y'all. Yeah, I didn't know. Honestly, when I got this injury like 4 months ago, me thinking, because I've had like a injury on my leg before that took a long, long time to heal. So when I got this injury, I was thinking like, okay, it's gonna go away. I'm thinking I just pulled something at the gym or something. Um, but a month passed by, it was still there. 2 months, 3 months, and now we're here at 4 months, and it's like the same as the beginning. So now I've started to like seek therapy, and I have to go to see the orthopedic doctor. Now I'm thinking about it, but I was not trying to hear that a couple months ago. If I could be honest, I was like, nah, this is gonna go away, and that hasn't been the case. But you guys have given me some very good, you know, tips, especially physical therapy. I definitely need to look into that. I don't know where I can put this at, but it's too big. Let's make this smaller. But yeah, very good advice. I was talking to a family member. They had a similar injury. And she was just telling me that it took her like 5 months for it to go away. I know you don't want to do cortisone shots. I don't. See, the thing with me is also to piggyback off of my D4 year surgery story. So once I got the surgery, they told me that I needed to start taking this shot called the Lupron shot. And the Lupron shot was supposed to help the endometriosis and do something. And I was like, no, I don't want that. But they convinced me to take this shot. It wasn't gonna have no side effects. Mind you, I'm in my last year of dental school, right? So I took a shot that was poisonous. I know cortisone shot is just steroids, but this shot that I took, you'll see why I'm against like any type of um, invasive procedures, even shots. But I took this shot, and I was supposed to take it in the 3 sessions. So the first session, the first time I took the shot put me in clinical menopause, which means I was basically feeling like an older lady. It put me in clinical menopause for just while I was on the shot, and I had hot flashes. I had severe night sweats. I had severe bone and joint pain. Um, I was passing out. I was in the ER to the point where they knew my name. I was having issues with my heart. It was basically a chemo drug that they put me on my D4 year, and I did not know. So the first time I took the shot, my professors would tell you I was at the school with like a fan. It was miserable. It was miserable. My energy levels depleted, and I just couldn't believe that I got all the way here to have to deal with this. So I did. Yes, the side effects of the shot is what really like nearly killed me, guys. I probably wouldn't be here if I would have took the third shot. So the second time I took the shot was like a couple months later. I think it was maybe like May or June. I think it was May, like the year that the month that I actually graduated dental school. And this is when it got the worst. I was in the bed and I couldn't get out of the bed. I was just laying there, like my whole body felt like it was on fire, 24/7. It was if you ever had chemo, then you would know what I'm talking about. But this chemo drug that they use for endometriosis, so um, we were calling the doctor like, hey, something isn't right. Whatever the side effects was, I got every side effect. I mean, I was constantly in the hospital. My mind went crazy. Like, I had been poisoned, and I was just laying in the bed, just hopeless. Like, I just couldn't get out of the bed. So that was just like one of the most traumatizing memories that I had from dental school. And even graduating, my graduation day, people didn't know that I was battling this terrible chemo drug to the point where graduation, I mean, all I wanted to do was sleep. I couldn't get out of the bed. I just wanted to just lay down. My energy was nearly extinct. Graduation night, we had a graduation party. I couldn't wait to be the senior. I mean, the D4 and party, but I couldn't. I almost missed the party. I got up so late, missed the party. I missed everything. I couldn't have a celebration with my family because I was so sick. Like, it was, that year was a true test of my faith. And like I said, if I had made it to the third shot, I probably would have died. But luckily, I called my gynecologist. I said, something is wrong with me. Something is wrong. So he ended up calling like 2 or 3 oncologists, and they told him, yeah, this is like severe. Like, she has to stop that shot. So I didn't take the third shot, but woo. So me with surgery, with shots, any of that type of stuff, it's gonna be hard for me to agree to have a surgery on my shoulder. It's gonna be really hard. So I'm gonna try everything, aqua therapy, whatever y'all mention. I'm gonna try everything to kind of prevent any more cuts. I might not be able to avoid it, but 6 months of healing time, that's pretty invasive. That's too much. I think I have to be a dentist like this. Like, I've been, and that's another thing. For the past 4 months, I did not stop doing dentistry. I still been doing dentistry, thinking, okay, my shoulder gonna get better. So I probably been actually damaging it more by not resting it. So I did rest for the past week, which I don't think is enough because I've been sick. So I've been forced to rest. But I don't know, guys. It's kind of hard when you are a provider, when your whole profession is your arms and your hands, and for me, and then it's a new dental practice, so we just started. I can't take off 6 months. I'm gonna be out of business. That's too long, but it'll work out. Monica says, I'm in perimenopause, so I understand all those symptoms. Oh, those symptoms, woo, I never thought I would be like a 30, how old was I? A 30-year-old when I graduated dental school in menopause. Like, clinical menopause, because it went away once I took the shot, but those hot flashes, night sweats, just waking up feeling like you cold but wet, like, ugh. I have a whole new I have a whole new, I shouldn't say appreciation, I have a whole new understanding of what women go through when they go through that transition from, you know, I don't know, what is it, being a out of menopause to going into menopause. Like, I didn't know it was like that. You hear women like, oh, I need a fan. Oh, I'm so hot. You burning up. You're hot. You're cold. You're just like, oh. That was me. I was like, I can't believe this. I was walking around dental school with my fan, like, whew. It's a miracle. That's why I say it's a miracle. Sometimes you don't know what people go through. It's a miracle that people can go through things like that and still push, still be positive. That's kind of how we started this video, is learning how to not allow your negative situations, such as what I went through with that surgery in dental school, or even what I'm going through now, or anything you're going through, how to not allow that negativity to impact who you are on a daily basis. Like, deal with it, but don't let it hold you down. Like, don't let it linger. You know what I mean? And that's what I'm gonna stay positive regardless of what happens. You just gotta roll with the punches. Keep smiling. Keep moving forward, because if you complain, that ain't gonna solve nothing. Complaining won't do a damn thing. John Ross, today is my birthday. I'm 35, everyone. Happy birthday to you. Woo! Happy birthday. Happy birthday. You halfway to the photo. Monica says, have you looked into natural healing? What type of natural healing? I've been recommended to put, is it shea butter on it? I've been recommended to, what else did somebody say? Tiger Balm. Couple things, but I mean, the times when I was looking and I saw rotator cuff injury, the stuff that I was finding wasn't good. It wasn't really good. So it says I'm supposed to do like a whole bunch of exercises. So I've been trying to like flex it. But you can see how this arm, like this. So they said you need to practice this with your arm. But with this arm, I can only get here and I can't really. It just hurts so bad. I don't want to. It just hurts so bad. I don't know, maybe diet herbs. Whoa. What happened there? That was weird. Where did it go? Where did your comment go? It said maybe diet and herbs. My diet is pretty much healthy right now, which could be helping because I don't eat meat. I don't I eat fish, but not like pork, beef, turkey, none of that. Just straight fish. I don't do dairy. So I've been no dairy, no soy, and like pretty much healthy. Trying to stay away from gluten, and that's just for other reasons. But the diet, I think I'm good with the diet. As far as natural herbs, that's something I could definitely look into. You know what I mean? So yeah. Uh-oh. I think I lost my game, y'all. But yeah, y'all gave me some very, very tangible things to do to kind of fix this issue I'm having. So I could definitely appreciate you. Definitely appreciate it. I think I lost this game. Let's do a new game. New game. Do. So yeah, no matter what you're going through this year, whether it's an injury like me or, whatever it is, let's try to end this year on positive vibes only. All right? Positivity only. And that could be tough when anytime you put out that you're trying to be positive, you know, negativity likes to creep into your atmosphere. So Monica says some marijuana strains are good for injuries, maybe CBD oil. You know what? I didn't even think about CBD oil. That might actually help. I don't know if it's gonna get my range of motion back per se. I'm definitely gonna have to go to physical therapy, um, but I definitely could look into the CBD oil because I know this has a lot of benefits. I feel like the recipe for me right now, taking this week off since I had this cold, really kind of helped it. But what I noticed is that it's not getting better. I've been just taking ibuprofen a lot and putting ice on it. I have this like TENS unit that I've been putting on it, trying to stretch it, but you see my stretching, I don't think I'm good at it. I really need a professional because I'm like, oh, that hurt. Nope. And then I don't do it. But I'm gonna have to do something, or I'm gonna have to switch my career. I don't know. I don't want to switch my career, but I'm being a little dramatic. Me, I just smoked the weed. LOL. Monica, Chief Monica, she be chiefing. Hey, hey, she be chiefing. Hey, hey, she be chiefing. I feel you. Yeah, I feel like the true solution for me is definitely gonna be physical therapy at minimum, plus some type of CBD oil and ice, and the water therapy sounds good, but definitely some type of physical therapy. And well, really the thing that I have to do is figure out what the hell is going on. So I'm going to get this x-ray to make sure, because I don't know, it could just be like, well, doc, you just need the surgery. And the ironic thing is I worked for a doctor last year. He had an injury to his arm, and I had just opened up the practice. He had an injury to his arm, and he was looking for a dentist to come and work in his office while he was out. And he recruited me. He came here. He was like, Doc, I just need you. I was like, I just opened my own practice. Like, but I'm like, that might be a good idea to have a little side money. So I was like, I'll think about it. So I ended up going to work doing root canals at his office for 1 day a week while he was out from his shoulder injury. And he was out for 4 months. And I didn't even think about, oh, that's going to be me next year, you know. But I can't get nobody to come work here like that. That's going to be a struggle. But regardless, like I said, everything happened for a reason, guys. Everything happened for a reason. I love dentistry, and I believe that if it's meant for me to still do dentistry, it'll all work out. But I know that eventually I might have to take a break. I don't know how that's gonna happen, but you know, life be lifing. Life be lifing. Monica, you is funny. That's so funny. She said, I be cheaping. Bump that. Oh, that is too funny. You got me tickled. Tickle, tickle. Push come to shove. Teach. Period. Yeah, push come to shove. You know, I could teach, but for me, I'm thinking I would probably be an online teacher of oral hygiene and um, definitely sell some things. And you already know I have my book over here, Hood to Hood It. That's pretty much, done, but in the final stages of being done. But I have so much going that I think I'll be okay. But if I am not able to do dentistry, I'll probably go home. I wouldn't be in New York for real. I'll probably have to go home. Back to Florida. To my people. Back to Florida. And I know they gonna love that. Because they're like, oh, Dr. Sean is coming home. That ain't really what I want to do, but I wouldn't mind it. I wouldn't mind going home. I don't know if I will stay there forever, but Maybe I would go to Jacksonville or Orlando or somewhere, but eventually I'll end up going back home. I know it. But guys, we just talking. We just throwing ideas out there. Enough of this injury stuff. It's so depressing. Not really. I'm okay. I'm not depressed about it. But it's just, unbelievable. Unbelievable. I'm gonna have to call that doctor and say, "Hey, man, you jinxed me. I don't work for you now. You gonna have to come and work for me. You can come over here and work for me." Undo. But yeah, thank y'all for some very, very good advice that I'm definitely going to take. I just have to get on the ball. Get on the ball, Dr. Sean. Get on the ball. Hell, if I have to go to surgery, I'll probably be live all day, every day. Hey, I get paid to go live, so I don't get that much right now. But if you do it every day, then maybe. But I'm just weighing the options here, guys. This is why you have to be. You have to you need more than one source of income. You need more than one stream of income. And even with a dental practice, there's so many things that I can do that don't require me to use my arm, such as what I'm doing right now, doing online classes, webinars, selling digital products. Even I can do teledentistry, talk to people through the computer that doesn't require me using my arm. There's so many things that I can do. It's just that when life presents an opportunity for you to pivot, and this may be something that is requiring me to pivot, something that I did not expect, you just have to pivot. Don't be afraid to take that risk, take that leap of faith. Like you said, I can teach, and that's a great option. So something is going to work out, and that's why I love being in the medical profession, and I love having that doctoral degree. It was hard as hell to get. I love having it because the opportunities are vast. Just having that behind your name opens up so many doors. So, eventually something is going to work out. Like, I don't know what it is, but I'm always about, like, being an entrepreneur, like, doing for myself. Like Oprah said, sign your own check. So I'm all about staying in that space where I can kind of control the narrative and have that autonomy that you kind of don't have in other practices. Like I would say my first 5 or 6 years working in other people's practices, like just getting that experience and realizing, damn, they got me working hard as hell. Dang, they were trying to overwork me. Every office, they like, well, you seem like you good, so they'll leave me to run the whole practice, I'm the only dentist in here. And when you first get out of dental school, you think, nah, they're not going to leave me to run the whole practice. But when you get out of dental school, so many offices and dentists, like, really trusted me to stay in their practice by myself. So that really got my skills up there. So I realized if I can do this for their office, why can't I do this for my own? But entrepreneur and just working in a dental office, two totally different things, guys. Let me put that out there. Entrepreneur, like doing the business part, is two totally different things. Two totally different things. Entrepreneurship is not for the weak. Dentalpreneurship is not for the weak. It's just not. Monica said, push come to shove, teach 5 months out for me. Yeah. Oh, you're done in 5 months? What? Dr. Stacker on the way. Hey, turn up. Hey, I know the feeling, man. Woo. Woo. To all the people out here making waves, getting those degrees, graduating, going from the high school to the bachelor's, from the bachelor's to the master's, from the master's to the doctorate. I'm cheering for you. Like, I'm cheering for you. Even if you just starting your business and you taking that leap of faith, you like, know what? I'm tired of working like this. I can make my own money. I can sign my own checks. I'm about to start my business. I'm proud of you. Keep pushing forward. Keep thriving through everything that you go through. And I know, Monica, those doctoral programs, they will make you know that you didn't know your brain could do so much. I know when I was going through dental school, I did not know. I kid you not, guys. When I was in high school, I'm gonna be honest. High school, I didn't really study. I was in the IB program, but I didn't really study. Like, I didn't know how to study. You don't really get taught how to study in high school, especially when you come from poverty, from the hood. I was just a smart kid. Like, I ain't want to be in no IB. The IB lady was like, you in the advanced or the AP classes and you killing it. We want you in the IB program. I'm like, I don't want to be in that hard stuff. I'm chilling over here. But they forced me to get into the IB program and I did not like it. But that opportunity that I didn't want kind of is what got me here. So I got into the IB program and that helped me get into Florida State University. I got to Florida State. I had to study. If you're going to be a doctor, you got to study. Like, you taking science, you taking math, you taking organic chemistry, trig, physics, biochem, all these damn classes, and you got to study. So I thought I was studying, right? I thought I was killing it, but I was studying, working at the hotel, doing work study at the medical school in the fly lab, and I was working at Winn-Dixie at one point. So I really wasn't focused on school. I was focused on school, but when you're from the hood, you got to be focused on school and you got to work. It's like in high school, I was working in high school. I was working at Wendy's. I was working McDonald's. So working in high school, going to school. Working in college, Florida State, and going to school. Probably doing a little bit too much then with my life. That's a whole nother story. Got done with that. Started a master's program. And I was working for the state of Florida to get them to pay for my master's to try to still get into dental school. But baby, when I crossed the path to Meharry, baby, Meharry do not play. I was like, what is this? I haven't been studying at all. I must not have been learning anything because nothing could have prepared me, baby, for that doctoral degree. Nothing could have prepared me. Well, everything prepared me. But what I'm trying to say is it still didn't prepare me. Because once you get into dental school, it's straight studying day and night. Everything that you eat, breathe, sleep, just straight books, studying like you don't got no life. And I say, wow, they teach you how to study. I didn't know how to study before. I'm like, dang, I wasn't even studying before. They teach you how to study and absorb so much information. So I know that those doctoral programs, if you in a doctoral program and you getting through it, kudos to you because it is not easy, baby. She said, baby, look, brain is braining. Wait a minute. She said the brain be braining. Listen. Woo! If you out there, listen, and you trying to get into the doctoral program, just please know your brain is going to be tested like never before. Your brain gonna be like, wait a minute, now I was just using 2%. I ain't know I could do all of this. I did not know that your brain can learn so much. Dental school did that. It made me realize, oh my God, I did not know that it was gonna be like this. You kind of figure it's gonna be like this, but once you in it, it's like, whoa, I didn't know. But you get in it, you gotta get in and get out. I had a lot of professors, a lot of other upperclassmen say, hey, you gotta get in and get out. You cannot get in here and play. So I got in there, guess what? I got with my study buddies. They know who they are. And hey, we did the damn thing. And the best thing you could do when you're going through a program like that is get with some people who gonna hold you accountable. You hold them accountable. Y'all study together, or get around people who are going to push you and know that you need that support and know how hard it is because, baby, you can flunk at any time, baby. And I was so crazy that I was taking care of whole family. And then I got more kids in my house and I had to do hair in dental school, baby. So listen, you're looking at the miracle right here. Yeah, she said, no, it's not easy. And it's online. Child, Webster University. Oh, listen, those online courses, Listen, I'm gonna tell you about one summer that I thought I was gonna be doing easy classes. Yes, my mentors are the best. You gotta have good mentors, period. So one summer, well, once I got done with Florida State, right? I got my little bachelorate degree and my little minors and stuff. I applied for dental school, did not get in. I had one interview at the University of Florida. Shout out to UF, the Gators, right? At this point, I was so not, I didn't have self esteem. I just, that interview did not go well because I got to the interview and I was the only chocolate person there. And immediately I got intimidated and I started crying. And I'm interviewed by a white lady and an old white man. And I got into the interview, I sat down, and I just immediately counted myself out. I just started crying, like, they don't really want me is what I thought. I'm like, dang, they don't really want me. Even though I'm sitting in this chair and they're interviewing me, something came over me and I just didn't feel ready. And I cried like a baby, right? So they said, you need to go get your master's. She called me. She said, we really want you at UL. She called me after the interview and say, at this point, we want you to go get your master's and apply again. I was like, damn, I thought I was in, but I wasn't ready. So I started working on my master's while working at Florida State. So I started taking online courses at the University of South Florida, Monica. And it was online. This is a time when online was not really a thing, like pre-COVID. Man, the first time I started my class was the summertime. Let me tell you, that was one of the hardest classes, some of the hardest classes I ever took. I mean, it was hard. And we had to write papers. We had to do papers. I was like, I'm thinking online gonna be easy, like it ain't gonna be too much, but baby, listen, the brain, what you said, the brain was braining? I was like, I know this class is not this hard. The professor was so tough. We had to answer all of these questions about health but in like a not like an essay, but like a research type of paper. And we had to do this like every week. So every week I was stressed out for that whole damn summer with that class. I say, oh my God, I ain't know online was gonna be this hard. I did not know. I was not ready. I was not ready. Oh my God. I almost prefer to go to the in-person class than the online class. Cause no. No ma'am. Yes, because you have to teach yourself, really. Yes, you have to teach yourself. You don't have that camaraderie of having your peers, really. And, you don't really have that personal relationship with your professors. So when you're on campus, and for me, I was in Tallahassee taking classes at University of South Florida. Some of my tests I had to go to South Florida to take, but like you had to take your test in person, but you don't have that ability to go ask the professor, hey, what are you looking for, to kind of pick their brain. So I'm just thinking, okay, I'm finna type this paper up and turn it in. No, you can't do that. I found myself so stressed out in that class. It is not for me. Not for me. I had to say just for me. Not for me. It was not for me. No thanks. Let me have a class where I can sit where the professor at, please. Please. That is too funny. Monica, you got me tripping today. That is too funny. But yeah, y'all have been giving me some great questions, some great interactions. I am loving it. So imagine 2 years ago, lost as heck. Yeah. I can't imagine. But I'm going to tell you something. Everything that you're doing is only preparing you for the next step. I didn't know that the classes that I was taking at Florida State, all the shadowing, the volunteering, even my online course, how difficult it was. Like I said, even with all the difficult classes that I took before, the doctoral, it just didn't prepare me. Well, it did prepare me, but y'all know what I'm trying to say. It still was a whole nother level. You know what I mean? Whole nother level. And I would not do it again. Nope. Would not do it again. No, thank you. They be like, um, no. You want to do it again? No, I don't want to do it again. That's why you want to get in and get the hell out. You don't want to linger there. You don't want to linger. So I'm just grateful that I even had the opportunity to do that. I really am. Thank you to Meharry. I'm forever indebted. Forever indebted to Meharry Medical College. Because like I said, I ain't get in that first time. I had to go take a master's. I had to go try to do more shadowing and go aggravate Dr. Polk and beg him to let me come to his office on Saturdays and shadow. I had to stalk him down like, Dr. Polk, please. I had to do so much. You have to do so much. And when you're in those stages of your dream, you're just like so eager. You're so fresh. Like you gonna make it happen. I was that kid, like, I'm gonna make it happen. When most people was up on a Saturday, like sleeping in, eating cereal, watching cartoons, I was that student like, hey, I'm gonna drive 45 minutes away, go to this dental practice because it's open on a Saturday, and beg this man to let me shadow him for free. I'm gonna work for free, sir. Because he wasn't answering the calls. I was like, I got to drive out here because he ain't answering the phone. You got to be that delulu for your dreams. And I was like, listen, I've been calling you. You are not answering. And I need to shout at you. I'm trying to be a dentist. I got denied last year. And I'm trying to get into dental school. And then he told me about, I think he didn't tell me about, he was like, oh, I went to Meharry. I was like, bet. That's T. And I'm forever grateful for him. Just allow me to do that. So I shadow him. I work for free every Saturday. So the people out there, oh, I'm too good. Listen, you got to do what you got to do. When you're trying to make things happen in your life, you come from poverty, you got to do what you got to do. Technically, I was shadowing, but I was cleaning rooms. So I was working for free, kind of. I wasn't getting paid, but I didn't give a damn. Guess what? Working for free with him, guess what it got me? A letter of recommendation. A letter of recommendation. And sometimes that's the golden ticket. When you want to get somewhere, having someone vouch for you, that's the golden ticket. And it can get you indoors that you normally wouldn't be able to get in. Because if I imagine if I had not been that bold and said, dang, well, he's not answering the phone, or I can't get him to answer the phone, and if I wasn't Delulu, I wouldn't be a dentist. I wouldn't. That move changed my life. So I would tell any parents out there, if you want your kids to go into these professions and whatever they want to do, even if it's not a school related career, whatever the career they want to pursue, get them in that environment. Don't just, oh, that's what you want to be. Okay, they gonna need your help to get there. They gonna need your support to get there. Don't just leave them hanging like, well, I hope you make it. No, you need to set them up for success. I wasn't set up for success, but baby, I found a way. Because I was like, I am not staying in poverty. Poverty don't feel good. Sitting here just stressing, living check to check, going to the payday, doing all this stuff does not feel good. I have to change the narrative. I saw my grandma struggle to take care of my sister, and I saw her struggle in her older age. With my mom gone, my dad just, at that time in the street life, I saw her struggle. I saw her write those checks, those bounce checks. I saw all of this. So for me, I was like, I got to change this. I have to change this for myself. And once my mom gave me that mission to go and pursue, be a doctor, it was just stuck in my head. I was like, this is it. This is what I'm going to do. Like, I don't have a choice but to do this. And you got to make it happen. Despite, if you think it's hard, easy, if you want it, you're going to make it happen. If you going to stay up all night to make it happen, you got to make it happen. And that's why a lot of the courses, they don't tell you, a lot of the courses in college are to weed kids out from making it. They're very hard. And they weed you out. And I know this is totally unrelated, but just speaking on that, like a lot of, in our communities, a lot of racism keeps kids out of those programs. This is a whole topic that I have for something else that I'm doing, but it was just showing them the research that I was doing of how systemic racism keeps kids out of these careers on purpose. It's set up for people like me not to make it to these careers. That's why there's only two historically black dental schools. That's why there's only 1 to 3% of dentists who look like me. Think about that. Only 1 to 3% of dentists who are melanated like me. I ain't say 10%. I ain't say 5%. I said 1 to 3%. And then there's a notion that a lot of kids don't want to do this no more. They don't see the benefit. And honestly, they making it really hard with the overhead and the student loan debt, that a lot of kids are like, I don't want to be no doctor no more. Like, you got to be crazy. I'm going to be a social media influencer. They don't want to do this no more. A lot of them. So, a lot of it prevents us from doing these professions. And I was reading something where I was listening to a lecture by this guy named Tim Wise, and he's a white man, but he tells like it is. He tells the truth. So I was listening to his lecture on YouTube, and he talks about systemic racism and how they give bad grades to black students, and how they give good grades to white students, and how normally white students are the students that they place into honor roll and advanced placement, and the black students are who they place into regular or remedial classes. And this has been going on since segregation was outlawed in 1954. He was just telling how even though they outlawed it, they still made it a way for them to discriminate inside of the school system by putting more black kids in regular or remedial classes, even if they were just as smart, and by giving them bad grades even when they didn't deserve bad grades. That's systemic division and racism. And he talked about how students of color were half as likely to be placed in advanced placement. Half as likely. And they are half as likely to be taught by the most experienced teacher. Monica said, facts. Yep, the dentist I go to graduated from Meharry. Meharry May, baby. We out you. He talked about how white students are 2 times as more likely to be taught by the most experienced teacher, and that black and Latino students are 2 to 4 times more likely to be expelled than white kids. Even though white kids were more likely to bring weapons and get caught with drugs, the black students were the ones being searched and all of this stuff. So it's a lot that goes on. That's why I say you have to really push your kids to pursue this, because the system is, even though we don't like to believe it or talk about it, the system is against people of melanin getting into these professions. And I even had an experience where, like I said, I went to so many different schools, moving all over, like custody battles, all this type of stuff. So in high school, I started school at one school, James S. Rickers High School, right? And in this school, I was automatically put in the AP classes because, this is a city, and being smart didn't really come hard for me in middle school, elementary school, high school. It just was like, okay, this was easy for me. But I moved with my another grandma to a whole nother county, and I was 10th grade. I went to a different school. I went to Wakulla High School. And because I had came from Rickers, they automatically put me in the AP classes because they could not put me in the regular classes, right? So in this advanced placement classes in Wakulla, what I noticed is that it wasn't a lot of melanated people in some of those classes. I was one of the only ones, only because I was a transfer. And I got into the class with this teacher named Miss Murphy. Miss Murphy must didn't know who I was. So Miss Murphy, it seems like she was kind of racist, right? Because she always had an attitude with me, and you notice like teachers who don't deserve to teach, they will exhibit this towards the chocolate student in the room because they don't want them there. And to her, hey, I'm not used to having a chocolate kid in my class. So for me, she thought like this paper said they'll give out bad grades, so she gave me a bad grade. I don't really get bad grades. So I was like, no, I don't know how you gave me this grade. So it took my grandmother to come up to the school and kind of pop off on her to really correct my grade. But that's one of the instances in a school system where they can kind of push the melanated kids to classes that they really, where they could be in advanced placement, but they don't put them there. So this is how they keep us out of these professions. So 10th grade year, I was like, I'm not with this. I got to go back to Rickards High School, which is a predominantly melanated school, versus the other school that I was going to where I experienced that was a predominantly white school. Okay. And I went back to Rickards and all was well. But I remember some of the things that Tim Wise was talking about, I actually experienced. So I know that it's true. That's why you have to really push your kids to do better, tell you when they feel discriminated against, or call people out for things like this, because all kids deserve equal opportunity. And how they break this up to systemize it is kind of crazy. And he also talked about how like police are 21 times more likely to kill black men than white men, even if the white man is 2 to 3 times more likely to be, the men, they are 2 to 3 times more likely to be unarmed. It's crazy. Like the history that I've been finding and reading, and just so I can understand the world, because ignorance is bliss, knowledge is power, and the more you know, the more you grow, the better you can maneuver through life. And this is just some stuff that I was researching for a different project that I'm working on, but I think it's relevant to what we were talking about now. I don't think I have any more that I want to talk about in here, because the rest of this is talking about like how the government created the hood. I ain't know how they created the hood till I did this lecture with Tim Wise. I didn't know how they created the hood. But he said that they created the hood. All black neighborhoods that are lower income were created by redlining, meaning it was legal until 1968 for banks to look at a map, take a red marker, draw a circle or whatever around black neighborhoods, and make these areas where they would not give the melanated people in that neighborhood, loans for their business, loans for their mortgage, loans for nothing, despite their credit, their education, age, none of that mattered. So that was called redlining. So the same thing applies like across all boards, and that was a form of discrimination. And this created the ghetto. It created poverty. So they did give those loans to the white counterparts, which allowed them to go to the suburbs and build and get out of those projects, as they call them. And he was saying that projects were originally for white people. Like housing projects were for white people who came over, and the government would just give them this housing for little or nothing. Okay? And then when they created the FHA loan, the VHA loan, the GI Bill, this allowed those poor white people to leave the housing projects and move to the suburbs. And then they said only whites could be in the suburbs. So then they moved all the black people to the hood, did not give them the loans, and this created the hood. And it created the middle class. And I thought that was very interesting because, my whole thing is from hood to hooded. I want to go from hood to hooded. Like, that's the whole thing. So, a lot of these issues with, like, teaching and education is so important. I know I just got kind of serious for a second. That's something for a whole other topic. But it's kind of relevant to what we're talking about when we talk about, studying and knowledge is power and all of these things. Monica said, LOL, you answer all of my interview questions I've asked my study participants. Yes. Yes. So, yeah, guys. I don't know how y'all feel about that, but, my thing is, in a perfect world, none of this would exist. And the only way to grow from it, to learn from it, is to talk about it, is to discuss these issues. Me being a student who has experienced some of these things, I can 100% vouch for what Tim Wise was saying. And it's not to target anybody, it's just to be aware. Because some teachers don't even know that they're being prejudiced or racist, and they don't even think about it. Just like the cops, they don't know that they're being, well, they do know. I can't even say they don't know. Some of them, what I mean is like, it's like a natural thing to, oh, black man, let me pull him over. Oh, black student, let me give him a D. You know what I mean? And you gotta watch your kids' grades. Make sure you pay attention. Cause I was a victim of that. And thank God for my grandma, cause she do not play. She don't play at all. Don't play at all. I keep losing this game because I'm talking about other stuff. And the other day I had a little challenge to see if I could beat this game in 2 minutes. I don't think I'm gonna beat it in 2 minutes, but yeah, y'all drop some more questions in the chat box. I told y'all I'm on here just chilling like a villain. I ain't going nowhere. The other day I did 4 hours on Twitch. I broke a record. Eventually I will get off of here, but not right now. I be seeing them on them sleeping, boy. I'm like, how they sleeping on there? But they be not out. I ain't gonna do that, but 49 seconds. Okay, let's start this game over. But yeah, like I said at the beginning of this live, we gonna end this year with nothing but positive aspirations and feeling good about ourselves. Just feeling good and feeling great. Like, what? It's no other way to be. So you go into 2025 with a fresh slate. I'm leaving all negativity in 2024. I wish I could leave my arm in 2024. Not my whole arm, but, only that were possible. So I'm excited to see what the new year is going to bring. Super, super excited to see what it's going to bring. Yeah, as far as business-wise, health-wise, knowledge-wise, I know this year, something very fun that I did was to do my genealogy. That was really enlightening to see where my ancestors came from. So this next year, I plan on to continue just breaking generational curses and standing on business. Regardless. I think I spent so many years of my life feeling sorry for myself, feeling like, sad without my mom here, feeling like, I don't know, like I said, internalizing a lot of negativity and just, I don't know, not being 100% my full happiness, because I've been waiting. But the thing you gotta know is that your happiness is what you make it. You can be happy today or you can wait. Like, what is gonna really truly determine if you're happy or not? It can't be money, because money ain't real. It can't be, materialistic things. Your true happiness, it's kind of like when you said healing. Healing comes from the inside out. Your true happiness is going to be an inside job. And many times people are looking for happiness from external sources, like, oh, this didn't happen, so I'm sad. No, keep your happiness regardless of the external things happening. Don't let it get to you and infect your spirit. Do not let it impact your spirit. Like I said, don't let the weight of the world, the stress of the world impact your spirit. It can be so easy to get lost in the sauce. It's too easy to get lost in the sauce, guys. Way too easy. So for me, we not getting lost in the sauce in 2025. We rolling up in 2025 like, what's up? Here, ready. What's up? Bring it. Bring it. We want more wealth, more prosperity. I'm in 2025. And even if you lost a lot this year, like for me, I feel like, I mean, with the insurance companies, I feel like, oh, what happened to my game? No, go back. Oh, there we go. I feel like I lost a lot dealing with that. But you live and you learn. Each day is an opportunity to live and learn. And that's what I'm all about. Living and learning. Life is so much better when you live and learn. Okay, so since I don't have any questions right now, I'm about to reset this game. If you got a question, put it in the chat box. But when I don't have a question, oh, what is this? What is that? So when I don't have a question, I kind of challenge myself on this solitaire, keep my brain like, fresh. So let's see if I can beat this easy level in 2 minutes. I have not been able to do it yet, but I've seen some people do it, so I like to try to challenge myself. All right, let's see. I'm probably not gonna win this game because I'm already starting off too slow. No. And yeah, y'all come in the room. Even if you just say hey and dip out, you know, let me know how you're doing. Thank you to everybody who has chatted with me so far. Monica, who else was a major chatter? Anthony Wiley, y'all really got those comments up. Thank y'all so much. I love it. See, I just lost. Let me start this over. I'm going to be starting this thing over. All right, so I'm about to focus. You got a question? Put it in the chat. All right, let's go. Let's go. Let's go. Let's go. Am I going to beat this? This is like a hard one, though. I don't think I'm going to win this one. I'm at 27 seconds. I'm doing good, but I don't know. I don't know how this gonna work out for me. Dang it. I took too long right there now. I took a little too long. I'm at 51 seconds, guys. 51. I'm at a minute. I don't think I'm gonna make it. Why do I torture myself like this to try to beat this game in 2 minutes? Like, why? I don't think it's gonna happen, though. I got 45 seconds left. Help me out. Can I do it? Can I do it? I'm stuck. Dang, I got 30 seconds left. 30 seconds, y'all. Can I do it? Can I do it? Can I do it? I don't know. I don't know. Let's see. Dang, I got 15 seconds left. 15 seconds. Dang. 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 Dang, 4 seconds. No. No, I got 4 seconds. Dang. I ain't do it. I lost by a couple seconds. God dang it. Dang. 17 seconds over. Why do I torture myself like that? I don't know. I placed 224 out of 641. Great. Let's try it again. Let's try it again. Try it again. Try it again. try it again. Who's gonna pop in the chat and check? Yeah, so oh, undo, boom, 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 boom. Don't mind me, guys. If you got something to say, just put it in the chat. Put it in the chat. Put it in the chat. I'm probably not gonna be on here much longer, but I'm not ready to leave yet. I ain't ready to leave yet. Okay, I'm at a minute. I don't know how this gonna work. This ain't looking too good. Not looking too good. Okay. Come on. $30 left. 30 seconds. 30 seconds. 30 seconds. Seconds. 30 seconds left. 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 Uh-oh, 15 seconds. Can I do it? Can I do it? Can I do it? Yes! I beat it in 2 minutes! Woo, 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 woo. 73 out of 495. What? Whew. That took a lot of brain power. I'll probably play this one more time until if I can beat it in the 2 minutes, then I'm going to end this live. So, y'all got until I beat this game to get those questions in. If you don't get them in, then I'm out the door. I can't believe I beat it. That took some real focus, boy. I was trying to do that for a little minute. Yeah, but I'm about to get off of here soon. It's been fun chilling with y'all on Facebook and all the other sources. I don't think my TikTok was showing up. I have to fix that. I'm not sure why it wasn't showing up. So if you were commenting on TikTok and I didn't respond, it's because I couldn't see your comment. Something I have to fix. I don't think I'm gonna win this one. It ain't looking good for your girl. It ain't really looking too good this time. So I'm gonna have to break my agreement and end it anyways. Yeah, I fucked up. Ciao. We're gonna end this. We're gonna end that. And I'll probably end my oh, let me see something. Dual output, multi-streaming, stream. You cannot change these settings when you're live. Oh. Unread notifications. CPU usage high. Doo-doo-doo. So yeah, guys. I gotta figure out how to do this. So yeah, thank you guys for chatting with me today. I was trying to figure out how to end my other lives and just do Twitch, but I can't figure it out. So I have to end all of the broadcasts at this point. And I'll probably go back live on Twitch today, but not anywhere else. I got some very, very interesting perspectives today. So thank you for all of the questions about teeth. We talked about school. We touched on a lot of things. Y'all helped me out with my shoulder. So I feel like this is a pretty productive live. So if you run by this on the replay, make sure you hit that subscribe or that follow button or like it or just leave me a comment and let me know that you stopped by. I've had a really, really pretty fun time on here. We should do this again sometimes. What y'all think about that? We should definitely do this again sometime. But yeah, do I have anything, love? Probably not. This is actually the longest I've ever been live on Facebook. The longest. So normally I'm on this mug for about 5 or 10 minutes. Never ever this long. So or maybe like an hour is the most, but not 2.5 hours. But time for me to hang it up. Whoa. Time for me to hang it up. Hang it up. Hang it up. Hang it up. Time for me